Do you think that if you have surgery on your nose because you have allergies, the allergy will go away after the operation? We might be able to reduce the symptom you're complaining about, but to completely eliminate the allergy, it won't go away except by avoidance, medication, or immunotherapy if medication doesn't work. Peace be upon you and God's mercy and blessing. The previous doctor I saw told me that I have a severe allergy in my nostrils that's affecting me, bothering me, and I don't know what to do or how to deal with it and what the treatment should be. And will I recover from this allergy or not? So what does allergy mean in the first place? An allergy means that our body has an exaggerated reaction. For example, our nose ache, we have an allergy. Normally air passes through our nose. This air is full of many different particles that are supposed to pass through without harming us. We shouldn't be affected by them or have any reaction, whether it's sneezing, a runny nose, nasal congestion, or even itching. These reactions are only supposed to happen when something actually irritates the nose or harms us. But for a patient with allergies, for some unknown reason, they start to have a very strong reaction from their nose or from any other area. If they have an allergy in their eyes, if they have an allergy on their skin, or if they have an allergy anywhere in their chest, the body is supposed to handle the things it is exposed to with the logic of the immune system. And the body itself shouldn't expend extra energy or effort, nor should it overreact just because of a breeze, a change in temperature, or smelling something that should normally be harmless. When a person has allergies and we don't know where they come from or what causes them, but when someone has an allergy, they start to show an excessive reaction. As for nasal allergies, the patient always complains that for no apparent reason, their nose suddenly gets blocked. They experience a very runny nose, sneeze intensely, and develop severe itching in the nose or the roof of the mouth, and sometimes it even reaches the ears. So what does it take to diagnose this condition and say that the patient has an allergy? It doesn't require more than what I've just mentioned. If the patient comes to us complaining of frequent sneezing, a constantly runny or blocked nose, and itching or irritation, and just these symptoms alone are enough for us to diagnose that they have an allergy. The doctor examines the nose, uses an endoscope, and looks for certain things that are similar to what I just described. And based on that, we diagnose that we have an allergy. So doctor, what is the cause? No one knows. No one knows why our bodies become sensitive to things that are supposed to pass by without bothering us or causing us any problems. And it can happen at any age. It can occur in children. Someone might come to me with an allergy at 40 years old, having never had any problems before, and then suddenly develops an allergy at that age. So does this affect us? Yes, of course. There are different degrees of allergies, and especially since allergies in some parts of our body are linked to other parts. The most common connections between eye and nose allergies and chest allergies, they often occur together in a large percentage of patients. And of course, this often affects the patient's sleep, which in turn impacts their work. Then the next day, when sleep quality decreases, academic performance drops, and sometimes the person can't even go to work. So we shouldn't take these things lightly or underestimate them because they affect the patient's quality of life and overall life efficiency, and we need to diagnose them. But for the patient to complain about these issues, we definitely need to make a diagnosis or to rule out other possible conditions in the nose that might have been caused by the allergy. For example, things like the development of polyps or other issues that might require interventions beyond standard allergy treatment. So do we need to do imaging to diagnose nasal allergies? No, not at all. We don't need any imaging as long as it's just an allergy issue. If the patient doesn't complain of any symptoms other than the 4 I mentioned, then we don't need to do any imaging. Okay, doctor, I've heard that there are tests that can be done for allergies. Yes, there are tests that help us find out what exactly we're allergic to. These tests are either done through blood samples or by injecting small amounts under the skin. We use them to test the body's sensitivity to certain substances that we inject. So, is it necessary to do this allergy test and determine exactly what we're allergic to? No, it's not necessary either. If the patient complains of allergy symptoms and we start treatment and they respond to it, then that's enough. We don't need to do the test. When do we actually need to do allergy tests? If we're not sure about our diagnosis, for example, when several diseases share certain similar features, and I want to make sure that this is really an allergy, or if the patient isn't responding to treatment. The usual allergy medication that we typically prescribe if patients don't get better when we give it to them and they don't respond. So we need to do allergy tests to confirm and identify what exactly we're allergic to. Knowing what we're allergic to usually makes a difference for us in most cases. If we respond to treatment, it doesn't really matter. but we might need it to find out what exactly we're allergic to. If it's a specific substance that the body is sensitive to, for a simple reason, in one type of treatment, we rely on immunotherapy. That means we take the things we're allergic to and inject them into the body to reduce the allergy or lessen its symptoms. Not everyone needs this immunotherapy. If we respond to regular treatment, then the diagnosis basically depends on what is said. Your account, what you say in the clinic, not the scans or the tests for the things we're sensitive to. So what should we do? We've diagnosed that this patient has an allergy. What should we do next? First of all, we shouldn't panic or be afraid. Secondly, we should try to avoid the things we're allergic to. I always tell patients, anything you smell, touch, wear, or eat, or even any place you enter where allergy symptoms start to appear and you were fine before. And as soon as you're exposed to these things, you start sneezing, having a runny nose, itching in your nose, and things like that, we should try to avoid them. As long as we haven't done an allergy test and haven't identified exactly what we're allergic to, the patient can sometimes figure it out on their own. The most common things found in homes are carpets, cats and other pets, birds and cats. There are also chemicals we might be exposed to at work, or dust, or a lot of dust and things like that. And people who work in places where, for example, yes, there's sawdust, certain odors or chemicals used in the industry or factory where they work. When someone tells you, I'm fine, but when I go to work, I feel unwell, or when I enter this particular room, it's often because of carpets or the office. These are very common causes. The first step is not to worry. The second step is to avoid the things we suspect are causing the problem. We try to reduce our exposure to them, or if we can't avoid them completely, we wear masks or use things that can block these substances. We should avoid exposure to the things we're sensitive to. So, is there a medicinal treatment? Yes, of course. The medications mainly consist of nasal sprays that contain cortisone, and this cortisone is topical, it doesn't enter the body. Its absorption is extremely minimal, so it doesn't cause the typical cortisone-related problems. We use these sprays depending on the severity of the allergy. It depends on the type, because some allergies last all year round, so we might use this treatment throughout the year, while other allergies only appear at certain times. For example, someone who is allergic to pollen, or whose symptoms appear in the spring or around flowers, in that case, they take the treatment during that period and then they don't need it afterwards. The nasal spray that contains cortisone either are other sprays that contain antihistamines. This is another type of spray that also provides a lot of relief for patients, especially in reducing itching. There are also pills. These are the antihistamine pills that we all know. These are allergy medications that we use alongside the sprays. They boost their effect a bit and help the body respond better to them. But of course, whether it's the sprays or the pills, whether they're allergy pills or cortisone sprays, we also like to have patients who have nasal allergies, for example, see a pulmonologist to make sure they don't have any chest allergies as well. Because when we treat both of these issues together, the person responds better. And there needs to be harmony between the doctors treating allergies, whether it's in the eyes and nose, or the chest and nose, or even the skin. Because a lot of patients come to me having taken antihistamines from one doctor and another from a different doctor and yet another from a third doctor. As a result, they end up using things without realizing that they shouldn't be taking all of them together, or that it's actually the same medication. The different brands can make it so the patient doesn't notice that they're taking the same treatment for the same allergy. But because one is labeled as allergy pills for the eyes and the other as allergy pills for the nose, actually, it's essential for us to collaborate with other specialties that deal with allergies the patient might have, so we can coordinate the treatment and improve the patient's response. For example, when we treat both chest allergies and nasal allergies together, the patient responds much better. Many pulmonologists refer patients to us in ENT so we can treat their nasal issues. Because when we improve nasal allergies, the patient's eyes get better and their chest symptoms also improve. So that's the medical treatment. Is there anything that can remove these allergies from our bodies without medication? We mentioned something called immunotherapy, and we use it so that we don't have to rely on medication. No, actually, if we don't respond to medication, or if we need to use it for a very long time and these medications start causing side effects, especially the pills taken for allergies, when the patient doesn't respond to this treatment, we move on to immunotherapy because they aren't responding to medical treatment. So, is there a surgery that can remove the allergy from the nose? Allergy is a condition that doesn't have a specific spot that I can remove to cure it. The patient doesn't get cured that way. But I can perform surgeries on the patient's nose. For example, if the allergy has caused nasal polyps, I can go in and remove those polyps, but the patient will still need to continue allergy treatment. If the patient's main problem with the allergy is that their nose is blocked, there are surgeries that can open up the nose a bit so the patient can breathe better and feel okay, but still, they will need to continue taking allergy medication. Of course, this varies from patient to patient, their need for medication and how long they'll need to take it. We can also provide several lines of treatment. For example, we might prescribe several medications, a nasal spray, an antihistamine, and a corticosteroid. Sometimes in severe cases, we need to use several types of treatment together, but we should be aware that in most cases, we'll need to take allergy medication for a long time. As long as the allergy is present, there are no surgeries that can eliminate it. And don't think that if you have surgery on your nose because of allergies, the allergy will go away after the operation. We might be able to reduce the symptom you're complaining about. But to completely eliminate the allergy, it won't go away except by avoidance, medication, or immunotherapy if medication doesn't work. Wishing you a speedy recovery. If you enjoy these videos, give us a like and subscribe to the channel so we know you're waiting for more new videos from us.